Father, we come before you today thanking you for the gift of life. We want to thank you for the gift of community, and we want to thank you for the gift of our families and for the gift of each other, Father. We know there are many of us who are not able to be above ground today, but you have, because of your kindness, you woke us up today. We are able to do the things we are doing, Lord Father. We know we are here because of your mercy. Whatever we are doing today, Lord, we know because of your love, you've allowed us to do it today. As we gather here in the name of Joes, Lord Father, touch each hearts of each one of us, Lord Father, so that whatever we are learning, we can be able to understand it well and be able to put it into practice, Lord Father. We are asking you to protect us, protect our families, protect our friends, protect Joes and every single thing we do, Lord Father. Make us just understand that it's because of you, and whatever we do is because of your fellowship, and we do it to further your glory, Lord Father. I pray and believe in the name of our Lord Jesus Christ. I pray all this in Amen. Thank you.
Thank you so much, Monica, for praying for us. And we just always want to respect other religions and other people who believe differently, but we believe, at least Monica prayed to Jesus, so that's her faith. So thank you for representing that, and thank you for calling on that. And ladies, again, I just want to welcome you again here for coming to attend our Joes Education Day. I want to thank the education team for putting up the topics this month, especially. Yeah, just want to thank the education team, and I also want to thank Cynthia for helping me reach out to the SHIF, the people who are in charge of SHIF, and getting us representatives to come and present to us. We do have 3 members represented. I'm not sure who is the lead here, but whoever is the lead, I'll go ahead and let you go ahead and mic yourself and introduce your team, and then you can definitely go ahead and start your presentation so we can finish in good time, and also leave time for our members to ask and our non-members to also ask. If you're not a member of Joes, definitely reach out to either Michelle, to me, or to Cynthia on the chat, and then just give us your contact information so we can follow up with you and give you further additional information about what Joes is and what we do, and why you are here today. But we're very happy to have the team from SHIF, or is it SHAF, come and present to us. Karibuni sana, and you're welcome. I don't know whether it's George or Deka. George, I'll let you take the mic and just go ahead, please.
Good morning, everyone. Can you hear me, please?
Yes, I can hear you.
Okay, my name is Deka. I'm the manager, Nairobi County, SHA. I have a team with me, and Michael Wanzia, the Senior Officer Quality Assurance, and George Kadede, and Senior Compliance Officer, Registration and Compliance Officer. I just want to say thank you for letting us be on your forum today. Our main objective is to sensitize everyone present today about SHIF, about SHIF Act, that is the Social Health Insurance Act 2023, that replaced the defunct NHIF. So today we'll be discussing the Act and the regulations that govern it. And as you know, that Social Health Authority plays a very crucial role in our health systems. Today we are here to demystify SHA, explore the various funds that are part of it. Today you'll also understand what is SHA, what is SHIF, what is SHIF. Other people on it, Shisha. Today we are here to understand all those words. So by understanding these words, the role of SHA is delivering universal health coverage for all. We are not leaving anyone behind. So as we take, we'll also look at the benefit package that is available under SHA. And knowing what is included in this package can help ensure that you can, at least you know what it is and what is available to you. Lastly, we'll also take you through the registration process that is crucial for everyone. You remember I said, no, we are not leaving anyone behind. So it is very good. It's very crucial for everyone to register and be informed and what is required of them to register, and ensuring that you can access the benefits under SHA without any hurdles. Currently, we have registered under SHA 23 million members, and against the 9 million that we registered in the defunct NHIF. So I will take this opportunity and George Kadede to do the process of registration, and then Michael can take over the benefit package. Just remember, an empowered society is a stronger community. Thank you. George.
Thank you, Decca, and hi to everyone. I hope you are all well, and by the grace of God, we are all in good health. My name is George Kadede. I will be taking you through the SHA regulations, and then I'll take you briefly through the registration process for individual persons. So I'm going to share my screen. Can I be enabled to share my screen, please? Kindly, host, enable me to share my screen.
Okay, I've made you co-host, so you should be able to share your screen now.
Thank you.
Are you able to share now? Oh yeah, there you go.
Can you see my screen, please?
Yes, now we can see your screen. Thank you.
Well, thank you. Let me just confirm if I'm able to control it. All right. Social health insurance general regulations 2023. I'll take it through briefly. I'll try to be as a little bit fast but audible, because I know a lot of the questions are going to come in, or a lot of interest will come in when my colleague Mwanzia will be taking us through the benefits package and what one is entitled to and up to what scope. So the areas to be addressed by the regulations of SHIF will include implementation of the healthcare fund, primary healthcare fund, implementation of the social health insurance fund, SHIF now, and then implementation of the emergency chronic and critical illness fund. And then, of course, the last 5 empanelment when contracting, benefits, tariff, claim settlement, and general provisions. The objective of the regulations was to provide an umbrella for implementation of the 3 funds. If you with NHIF, we just had NHIF as one body that was taking care of everything, and if you realize, there's been an introduction of a third element that was never there in NHIF. That is the ECIF, Emergency Chronic and Illness Fund. This was not there before. And then the Primary Healthcare Fund, where members will be seen through the level 1, 2, and 3 facilities. And this will take care of members as long as a member is registered, whether paid up or not. Any member, and that's why Dec has mentioned that the goal is to have all members, all citizens in the country, or anybody who resides within the country, to be a registered member of SHIF, to enable them to be taken care of whenever they need their medical cover. So primary healthcare fund is there to take care of anybody who's a registered member, whether paid up or not, should one need to seek medical services, they'll be treated, taken care of under level 2 and 3 facilities. The purpose of the fund is established as a pool for receiving and payment of funds. And also, it's important to note that SHA or SHIF has to involve or bring on board as many as possible healthcare facilities. Those who are willing to join, number one, government facilities are mandatory, and it's automatic that they'll be providing services to the members. And then the private sector, we are mandated to bring as many as possible into the pool of healthcare providers to take care of the population and to offer a wide range and close reach of services to our members. So in order for one to access primary healthcare fund, number one, they must be registered by SHIF. And as I've just mentioned, they'll be able to seek services at level 2 and 3 facilities. These are our dispensaries within our communities, and these are spread across the country. Services that will be offered under PHC, Primary Healthcare Fund, include the list, which is, I'll not expound because my colleague Monzia will do a clear explanation of all these. But the services will include promotive services, preventive services, curative, rehabilitative, palliative, and referral. The last palliative care was something that was introduced that was not there in under the defunct NHIF, and so is the referral services. Now, social health insurance fund. This is where now everyone, number one, anybody who is employed within the Republic is deducted, or deductions are made from their salaries by the employers, and this is mandatory. It's one of the statutories that we have, that anybody who is employed has to contribute to this fund through deduction from their employers. And then the rest of the public who are not in formal employment are required to do voluntary contributions into the accounts to be able to seek services. Now, as I mentioned earlier, that primary healthcare fund is for anybody who is registered. The level 2 and 3 facilities, anybody who is a registered member of SHIF will get services from the level 2 and 3 facilities. Now, when it comes to SHIF, Social Health Insurance Fund, now you have to be a paid up member of Social Health Insurance Fund of SHA. You have to be a paid up member for you to be able to seek services under SHIF. That is to say, if, for example, person X is a registered member and is in need of services, and they're taken to primary healthcare, the primary healthcare facilities, level 2 and 3, they'll be taken care of. Now, should the case, as I mentioned, these facilities are the dispensaries across the country. Should the case for this member be in a situation that cannot be taken care of under the dispensary, this member now will be transferred or referred to a higher level facility that is now 4, 5, and 6 facilities. Now, at that point, the member will now be given the choice or be told or will be advised to now activate the accounts by making payments. And the beauty with the Social Health Insurance Fund is the moment you pay up, your card comes active instantly. So if I went to a dispensary and I'm told we need to refer you, say, to Kenyatta National Hospital or Moi Referral Hospital, then I have the option of, making payments making payments and submitting, so that as I'm on the way to the referral facility, by the time I get there, the card is active and I'll be admitted or get the service that I need at that level facility. So the fact that the pooling of resources, of course, social health insurance fund is a social insurance, as the name says. So the pooling of resources from, number one, the mandatory contribution from the employed, and then the voluntary contribution from the members, bring the resources together that is able to take care of both all of us. Anybody now who is under SHIF will be taken care of. Now, the primary healthcare fund, sorry, I forgot to mention it, this will be taken care of by the exchequer. That is why if you a member of the public goes to hospital at those level facilities, they're taken care of even if they have not paid. All they have to do is to be registered. Registration process includes, number one, you need to have your national identification card. We've also noted, or we all know that we have a lot of refugees who are residing within our boundaries. So the government has made it possible for them to be registered under SHIF, and they can make their contributions or payments under SHIF, whether at personal level or whether they have some donors who are sponsoring or sponsors. They're able to do the registration using the identification for refugees. So in this case, normally it's the refugee mandate. And then we have a lot of foreigners also who are working within our country as expatriates. They are also able to register and get services whenever they go to the hospital. So those are the main documentation we need for registration. And also, of course, as a member, I'll come with my dependents or beneficiaries. So to register your spouse, we need a proof. You need an ID as proof, her ID or his ID, and proof of marriage. We normally are asked for either marriage certificate or an affidavit. For the children, we need a birth notification for children below six months. Any child who is now above 6 months onwards, we need to provide the birth certificate. And of course, among us, we have people who have adopted kids. So yes, we need to avail adoption certificate. And for a child who the contribution, if you're a guardian of a child, then you'll avail a will, a deed, or court order to prove that the child is under your custody. We also have persons who are living with disability. And in this case, if you are a member and you have a child who is living with disability and is fully dependent on you as the guardian or the parent, then we will have this child registered as your beneficiary, whether through the birth certificate or their IDs if they are grown up. And in this case, if it can be established through the doctor's advice and recommendation that this child is fully dependent on you as the guardian or the parent, then this child will be one of your beneficiaries for the rest of their lives. So whether they are 30 and they still depend on you fully, of course, they take care of them. Now, a new introduction that the government has brought on board is taking care of persons in prisons or remands. The government has come up with a way of identifying all our prisoners or guys in custody, so that while they're under custody and the one gets to need service, then they're taken care of by SHIF. So they will be registered by SHIF using their IDs or a unique identifier. And then in this case, the government, the exchequer, will take care of their contributions so that whenever there is services, they're taken care of. Of course, this also applies to child in conflict law. We'll use the admission numbers as the children's remand homes, rehabilitation institutions, or Boston institutions, or the child birth certificate. So the last two categories of members of our society are taken care of, and these two will be their payments or contributions to, or the premiums, let me use that, premiums will be paid by the exchequer, that's the government. There are cases where one wants to do an amendment to their status or the status of their beneficiaries. Of course, if it's a spouse, maybe by the time I was registering, I had no spouse, and now I have a spouse, and I want to include them in my card. I will need that ID and proof of marriage. For the children, adopted child, of course, I said court order. And then there's a case where a member wants a spouse to either be expunged or removed from their database. In this case, it's either if I want to remove a spouse, you need that if maybe there's cause of divorce, you bring a decree of divorce. And in the case of demise, then you'll avail this death certificate, and that will be used to do the amendments to the card. Another important thing to note is the children. A child should be registered within 14 days from birth. So it is recommended or advised that if a member gets a newborn within 14 days, or even within 14 days, that means even while it's still in hospital, you are required to declare that child the moment you are provided with the birth notification, declare that child in the system. The contributor should use the birth notification in this case to declare the child. And later on, although this has currently not been introduced, but it's something in the pipeline, they're working on it, that biometric registration will be done for all members of the public, so that once you register this child within 14 days, by the time they attain 7 years old, it is deemed that their biometrics are fully grown, and that can now be captured to be used in future whenever they need to get services at the facilities. The registration, I already talked about that. A beneficiary shall be deregistered upon death. And of course, one will have to avail the death certificate for that to be done. What I want us to note is the household. If the principal member passes on, and he had paid up, say, for 1 year, in this case for the voluntary or self-employed people, with SHIF, they are required to pay 1 year premiums in advance. So should the principal member pass on, then the household or the beneficiaries will benefit from that card until the last payment, the last month of contribution. So that is something that is important for us to note and pass that information to our relatives and our friends so that they're aware of that. I'm sure we are all aware that SHIF contributions or SHA contributions are not the same or not being done the same way as NHIF was, where it was standard that the employed, it was staggered given the salary rate, and the self-employed or the voluntary contributors, the premiums were standard 500. Now, in this case now, the premiums are staggered or are capped at a 2.75% for the employed people. And it's also, the same is also brought down to the households with income from non-salaried employment. And that is an array of, I can say it is almost all other households who are not in permanent employment or informal employment. So the government deemed it fit to put a percentage of contribution that every member of society can do. And this was because it was the 500 flat rate was seen to be puny. Let me use that punitive on a light note to the less fortunate in the society, where there's somebody who is not in formal employment, but they're doing pretty well financially, and there's somebody who is low down there in the society, and the premiums were capped at 500 for all of them. So it was deemed to have a percentage so that those who are well off or who are blessed can contribute more. And of course, being a social health insurance, if you take care of the less fortunate, as it takes care of also those who are able or are well off. I think I already mentioned people in lawful custody, and to save time, let me not repeat that again. I'm also sure that we've heard of this, the means testing tool. This is a tool that MOH, Ministry of Health, came up with, of course, in consultation with various stakeholders, to enable them or a member know, to enable a member be graded or as I've talked about the 2.75%. So the means testing is able to tell the socioeconomic status of an individual, so that person X might pay slightly higher or lower than person Y. So they came up with an array of questions, socioeconomic questions, that a member will answer. At the end of it, you'll be told that you'll be paying so much premiums per month. So this, I'm sure we've heard of it. Sure, people have raised queries about it. So it is something that, and of course, I believe MOH, through their right guidance, know why they came up with this. So this is what we're using now, and hence there is no the flat rate of 500 that used to be there. This is what now is taking care of that, so that person X and person Y, their premiums will differ once they answer those questions. The third fund is Emergency, Chronic, and Critical Illness Fund. The beneficiary will benefit from this only after depleting. Now, in this case again, so that we don't have duplication of the same thing, allow me to skip this. I just mentioned it as one of the funds, the three funds. Allow me to pass this so that my colleague Mwanzia takes care of it comprehensively when he'll be presenting. And of course, now in Parliament, or bringing on board of all the healthcare providers, this now as initially with NHIF, it was NHIF who was doing the inspection, accreditation, and panelment, but this now has been moved to the right bodies, so that NHIF, SHA, is not directly involved in doing the inspection and determining which facility meets the criteria to be allowed to offer services. Of course, that is the contracting of healthcare providers. Again, this has now been taken and is being done by the authority, the right body that forwards the right people or the right facilities to share and enables them to offer services to the public. Benefits, this will be done by Mwanzia again comprehensively. So so that to avoid repetition, I will pass that. Now, this pre-authorization. Pre-authorization, healthcare providers facilities shall send requests for pre-authorization for specialized healthcare services. This, I think, is a common practice across all health insurance companies that or hospitals must send a pre-authorization, so that it is case by case. It is looked at a case-by-case basis, and if it meets the threshold, then it will be approved. If it doesn't, of course, it will be rejected by SHA. And then there's treatment outside the country. Number one, for a member has to be up to date in payment. The treatment sought for must not be or is not available within the country, and that's why before anybody goes out, they have to get clearance from Director of Medical Services, MOH, so that it is clear, they are clear that the service they are seeking cannot be offered or is not available within the Republic. Hence, that's why they have to go outside. So once they're given clearance from from MOH, Director Medical Services Office. Then they bring that clearance to SHA, which then facilitates their travel to abroad for treatment. That will be the end of that presentation. I'll just do a short presentation on registration process. If you allow me, just a short one on the registration process. And then if the convener, maybe, I don't know if we'll do the Q&A at the end or they'll have it in between, but I would recommend at the end so that we take them all up once Mwanzia is done with his part.
Yeah, we're welcome to do it at the end. Just go ahead with your short registration presentation, and then we'll do our Q&A at the end. But thank you so much so far. Mr. George Kadeda, what I was going to see if I can give Mr. Mwanzia ability to share his screen, but I don't see. Do you know if he's logged on already? Or what name is he logged on under? Michael Mwanzia?
Yeah, Michael Mwanzia.
Okay, I'm going to go ahead and make you also co-host so you can share your screen. Okay, go ahead.
Are you able to see my screen? There's what I put up kindly?
Yes, we see the Social Health Authority self-registration.
Yes. Thank you. I'll take you through this briefly. I want to try and save time. So as I do the presentation, for this registration of individuals, we have what afyayangu.go.ke. Now, when you get to afyayangu.go.ke, you should be able to get to this screen and sorry. You should be able to see once you click proceed, you should be able to see what I'm just projecting. So where you'll select whether you're a citizen or a foreigner or a refugee within the country. You enter your ID number, then it will ask you for your phone number, and then you can click proceed. It is very interactive. It's a very, let me use easy, and with the registration as opposed to what was then in NHIF, this has been made such that a member is in full control of this process of registration. And this can be attested to by the number of, like I mentioned, the number we've already registered. With NHIF, members had to walk to either our branch networks or Huduma centers to be assisted to do the registration. Now, with the SHA and technology now, members are able to do this at the comfort of their homes, just using their phones, do registrations. Once you enter these details up here, you get an OTP to allow you to log in. So you'll set your password, your own password PIN that you'll be using for any time you want to access this site. And anytime you go to Afya Yangu, you enter your ID and you enter your PIN, OTP will come to allow you just to verify that it is you who is trying to access that account. So the member will be in full control of this. And again, when you see here, it's the member, sorry. Sorry, yes, I lost a little bit. Just give me a minute. I hope you can have it there. As I just said, the member has full control of the system. They do the registration. The member has full control to add their own dependents, or whether it's the spouse, the children. And what we all have to note that is that when you're adding a spouse, this spouse must first be registered under SHA. So before you add your spouse, if you try adding your spouse before he or she is registered under SHA, you'll get a notification that the spouse is not registered. So after self-registration, you can be able to add your spouse. And you also require to provide proof of marriage and all that. But mandatorily is, you will also be required to provide a phone number and an OTP sent for consent. So if I'm registering myself and I'm adding my spouse, because she's already registered in SHA, she will get an OTP on her phone, which she then shares with me to allow me as consent that okay, I've given you the go ahead, add me as your spouse. This is something that is of a great improvement for us. With NHIF, a member would walk into the office and say, kindly add the spouse. And sometimes down the line, we had a lot of challenges with people saying, I did not say add that spouse. I don't know who that spouse is, who added that spouse to my card. But with this one, the spouse has to give you consent to add him or her. So it's a great control that you cannot say it was maybe a staff or did it erroneously, or a staff was trying to take control of my account. The member is fully in control of this system. Now you can adding of the children again, you can do the same. All you need is the birth certificate, which will also be uploaded to the system. And if the kids are above 18, then we will use their IDs. So any child who hits 18, please let's get them the IDs to be registered. And I did mention earlier on, for children are covered up to the age of 21, but up to the age of 25, up to the age of 21, they're automatically covered under you as the guardian or parent. But from 22 onwards, but not including 25, the kids are covered only if they're in school full-time, they're in college full-time. And this will be proved by availing letters or identification from documents from the school. So it is something important to note that the kids will be covered up to 21. But from 22 going onwards, they must be in school full-time for them to be covered under you as your beneficiaries. Biometric registration is still being worked on, but currently all of us are able to seek services using the one-time password that is sent to our phones whenever we visit the hospital. So if my kid went to hospital, wherever she is, she's in a boarding school, so if she's taken to a hospital by the school, an OTP will be sent to me, which then I avail to whoever has taken the child, if it's the teacher, for them to be able to access my account and have the child treated. This applies to the spouse and even me as a member. The account, of course, will look something like this. Once registered, you'll upload your passport, you'll upload your members, your beneficiaries' passports, so that at a glance, when in hospital, they're able to see this is so-and-so, the images are there. And this has really helped to control fraud that was there previously. Otherwise, I think I'll leave it at that, because if there's anybody who's maybe trying it, as I was explaining, you find it is so straightforward, registration process, it's very easy. And should there be any challenge or any questions, allow me to answer them, come to them at the end. I want to allow Mike to come in because his part quite takes a bit of time and he needs to do proper explanation to the members. Because once I've registered, how do I benefit? I think that's the greatest interest that now we have. Up to there, kindly allow me to sign off and allow Mr. Mwanzia to come in.
Thank you very much, Mr. Kadede. Mr. Mwanzia, go ahead, please. Thank you. And ladies, I hope this information is good for you and you're taking down your notes. We'll definitely have a time of questions later on, so definitely make a note of your questions. We'll come back to them.
Good evening. Thank you, everyone. George, you can stop projecting so that I can share my screen.
Just a second, I'm trying to get out. Okay. Sorry, I'm having a bit of challenge getting out.
Oh, okay.
Let me just close this thing. So.
Are you able to see my screen?
Yes.
Thank you. Good evening, everyone. I'll just briefly take you through the benefit package as defined by SHA regulations. As you have heard from my colleague, we have 3 funds: primary healthcare, social health insurance fund, ECCF, emergency chronic and critical illness fund. Just before that, I just want to mention this for the purpose of understanding where we are and where we are coming from. Initially, we had NHIF. NHIF was purely what right now we are referring as SHIF, Social Health Insurance Fund. A member must register and pay for you to get benefits. Now under SHA, we have 3 funds, and the purpose of SHA was UHC, Universal Health Coverage. Every Kenyan to have accessible to quality health care. And that's why government saw it wise to start the other 2 funds, whereby all of them are government-funded programs through Exchequer, starting with primary healthcare. This is a benefit accessed by all registered SHA member. What you need to do is to register as a SHA, then you get the benefits. I will go deep what entitles to PHC. Then SHIF, it's what, as I said, is about you register and you pay, you get benefits on that. ECCF, Emergency Chronic Critical Illness Fund, is funded by the government, includes things like accident, emergency services, and is accessible to all Kenyans. Even some services here will be accessible to Kenyans, even if they are not registered. I will explain how and when. So, starting with the PHC, Primary Healthcare Fund. This covers outpatient, inpatient screening, and optical services. But for now, we are only doing outpatient and inpatient. Outpatient, this one catered for acute and chronic conditions, which includes investigations, lab works, imaging, that's X-ray, treatment, medications, procedures, and outpatient, mental health conditions, and maternal outpatient services, that is antenatal care, care before delivery, and care after delivery, that is postnatal care, PNC. Then, how these services are achieved, or rather, how government pays this for these services. Government is paying 900 shillings per person per annum. I'll explain how that one works. You may see, or it may sound something little, but this is the allocation per person per year, not per patient. So I give you an example, like let's say Nairobi County, whereby we have like 1 million registered members. So we multiply that 1 million multiply by 900, you get 900 million. That's the fund available for outpatient services. And that fund is not per person, is now for the patient who will visit the healthcare institution. These services are available at level 2, an equivalent of dispensary, level 3, health centers, and level 4, those are sub-count and count hospitals. Optical, I'll not dwell so much in it because right now it's not operational, but government has proposed we have a limit of 1,000 per household for beneficiaries below 18 years. This is a service which was not available under NHIF, but now government is introducing it under SHA. Inpatient care, in case someone is admitted, we are paying what is called a daily rate, or rather a daily charge per diem of 2,240 shillings per day, multiplied by the number of days spent or patient was admitted. It has a limit of 180 days per household. That's an equivalent of 6 months. Also, an inpatient, allow me to mention this one. We have under PHC delivery. It may be a daycare service, but can be covered under inpatient. So delivery is covered, an equivalent of Linda Mama, which used to happen under NHIF. So those mothers, they are catered for that. Now, to the point of our main interest, SHIF, Social Health Insurance Fund. This is the fund where most of us belong, for those who are deducted from their salary or for those who are paying for their monthly premiums through their own arrangements. The benefits under SHIF include outpatient care, inpatient care, maternity, neonatal, and child health care, renal care therapies, I'll expound on that, mental wellness, surgical services, oncology is cancer related, medical imaging and other diagnostic services, then overseas treatment. Remember, I've mentioned about outpatient in PHC. Now for SHIF, we are doing lab work, diagnostic of 4 main conditions. That is diabetes, hypertension, sickle cell, COPD, that is asthmatic, with aim to build a chronic disease registry. And we have a cap or a limit once per year per person. And this means an household can benefit more than once because we have many persons in the household. So for example, diabetes, we're talking of 4,300. Sickle cell anemia, for lab work, we are talking of 6,800. Hypertension, 2,850. Then COPD, 700. Inpatient services. Inpatient, this is mainly when you are admitted for medical related cases, not surgical, not radiological, and not something for like dialysis. I'll talk on this one separately. And this one is determined by, initially under NHI, we used to say NHI pays kitanda. It was a rebate. So those rebates were revised upwards per level of care. We have level 4, level 5, and level 6. Level 6 is an equivalent of Nairobi Hospital, KNH, Aga Khan, among others. So we are paying 4,480 shillings per day, multiplied by the number of days spent in the hospital. Then still the same limit of 6 months applies per household. In case the bill, if you go to those high-cost hospitals like I've mentioned, Nairobi Hospital, Mata, Coptic, you'll be charged the difference. But there are those low-cost hospitals like the GeoG facilities in level 4, level 3, you will not be charged the difference if you pay that amount. Maternity, newborn, child healthcare services. Mainly, this one is about delivery, because I've mentioned about outpatient in terms of the clinics and a PHC. When you are admitted for a delivery, normal delivery, irrespective is a twin pregnancy triplets, SHA will pay the hospital 10,000 for normal delivery. In case you are admitted for cesarean section, that's the surgical way of giving birth, SHA will pay 30,000. This one is not based on the number of neonates or the babies you deliver, is per procedure. Even if you are delivering twins through CS, we'll pay 30,000. And this service is available in all levels of hospitals, starting from level 2, an equivalent of dispensary, up to level 6, an equivalent of a referral hospital like KNH, among others. Renal care services, dialysis. Now, we have those patients who are on dialysis. They are being dialysis because their kidneys are not functioning. They have a chronic renal diseases and the kidneys are not functioning well. We are doing hemodialysis, which we are doing 2 sessions per week. It doesn't have a limit in terms of per year. It's only those 2 sessions per week at the rate of 10,650 shillings. We have other procedure known as peritoneal dialysis. If you multiply those 2 sessions, multiply by 1 month, you will get an equivalent of 85,200 shillings. So the same amount will be paid because it's done per month, but it's an expensive procedure. That means the patient or the next of kin will top up the difference, which will exceed SHA cover. Access rules. This one is accessible to all facilities which are licensed and are conducted by SHA to offer these services. Still under renal care, we have renal replacement. This services was not there under NHIF. It's a new package, or it's a new product under SHA, whereby we are talking or we are taking care of patients who will undergo renal transplant. There are those cases whereby doctors, nephrologist who is treating your patient will tell you this patient can benefit better from transplant rather than dialysis. Then there are tests which are required before the actual transplant. And here we are taking care of up to 150,000 per household. Then the actual surgery will pay around 700,000. Not really around, will pay 700,000 because the amount will be higher than that. The client will top up the difference. Then also we are saying that a donor, if donor is a SHA member, we will pay for the surgery of the donor 168,000. Then after transplant, we have treatment for that. The kidney will function well. The kidney body will not reject it. We call it post-renal replacement therapy. We are doing up to 200,000 shillings per household. Mental wellness. This is mainly about treatment of mental illness, and in this case, we have categorized them into 2. We have those people who are suffering from mental ailments, schizophrenia, bipolar, among others. Those will be treated based on the level of care where the patient is admitted. As I mentioned earlier, we have level 5, level 6, level 4 with each rate. Then we have another very special category, commonly nowadays in our society, people who have abused drugs and they need rehabilitation services. Now SHA has a package for rehab services. A patient will be admitted in a rehabilitation center and SHA will pay 67,200 for the entire stay. Then the member will pay the difference. Most probably it will cost more than that package, but at least SHA will meet that cost. Still, because in admission services, the rule of 6 months applies. Now, still under inpatient, we have surgical services, or rather surgical procedures. And purely, I'm talking about surgery here. We are saying that under SHA, we have categorized surgical services into three. We have specialist surgeries. These are surgeries which require specialists and eye specialist hospital. And we have minor surgical procedures. These, they don't require such a specialty. They are just done mostly by general practitioners and major procedures. So we are saying per household, we can cater for one specialist surgical procedure. An example is a craniotomy, whereby a patient has been diagnosed with a problem, maybe a brain tumor, and surgeon, in that matter, neurosurgeon want to do a procedure to open the cranium, that is the skull, to remove the tumor. Then we have major surgical procedures. We are saying we are doing 2 per household per year. These include things like fractures. Someone has a fracture of leg, that is lower limb or upper limb, and you need an ORIF, a tumor, for you to function well. So we are doing 2 major surgical procedures. Then minor, the one I said, they can be done by general practitioners. These are things like when you are cut, suturing, things like drainage of boils, among others. So each surgical procedure has specific price attached to it in our contract between SHA and the hospital. For example, a surgery, open heart surgery is a specialist surgery. We are paying 900,000. A minor procedure like the one for boil I was giving you example, we are paying at around 20,000. So the range of costs per procedure. Hematology and oncology. This is blood work in relation to cancer treatment and the cancer treatment. We are saying now for oncology treatment, a patient has an allocation, or rather a family has a limit of 400. But recently this amount was revised upwards from 400 to 500 and 150. But this is how to access it. 100 is for diagnostic, 100,000. This is to limit cases whereby someone may do a diagnostic, that's the lab work, the x-rays, CT scan, MRIs, you finish your allocation before the treatment. So for the first 100, you will spend it under diagnostic. Then the balance, that is 450, you will use for treatment. Now that is chemotherapy, radiotherapy, brachytherapy, among others, or as prescribed by your doctor. Medical imaging. These are things like MRI, CT scan, angiogram, mammogram, fluoroscopy, echo, ECG, as you see from the projected screen there. Each image has price attached to it. MRI, you can see from there, is 11,000. What is missing in this list is PET scan. PET scan is covered by SHA at the rate of 53,500. So you can include that one. PET scan is covered by SHA. And we are saying all these services, the limit is 2 imaging per household per annum. In case you do 2 MRIs this year, you have to wait for next year for someone to benefit from that household. Same with CT scan, same with the fluoroscopy. Oral healthcare, this one I'll not dwell so much in it. It was supposed to be introduced as an outpatient benefit, but because of availability of the funds, as I said, primary healthcare is under government-funded projects, now is not available. So it will be rolled up in 2 years' time. Already seems like we have done 1 year, so in the next 1 year, maybe it will be functioning. Overseas treatment. This my colleague George has mentioned this one, but to be specific, we are doing a limit of $1 million per person, and we are only referring cases which cannot be handled within our Kenyan territory. Any procedure, any medical service which is available locally, SHA is not referring or will not do reimburse for those patients who will prefer to get treatment outside the country. Now the last fund, ECCF, Emergency Chronic and Critical Illness Fund. Under this one, we have ambulance services, that's for evacuation, accident, chronic illness, assistive devices, critical and palliative. Under ambulance services, the purpose of this is to evacuate from the scene of accident or from the scene of incident to the nearby hospital. Mark, this one is not to the preferred hospital of choice. An accident may happen somewhere outside Nairobi, for example, and you prefer you go to a specific hospital, like you want to be treated in Nairobi hospital. For this fund, we are referring to the nearby hospital for the purpose of saving life, not to the preferred hospital. What you're seeing there, those are tariffs on how to refund. This is the agreement between the service provider and SHA. Service provider for now is the Red Cross and the county government ambulances. A period within 25 kilometers, we are paying 4,500. Outside 25 kilometers, we are doing the government rates. That is per kilometer, 75 shillings per kilometer. But that's for your information. It's more of the for the service provider. Accident and emergency services. This is the services which will be accessed by all Kenyans, registered or non-registered. That means even if you have not paid, you can access this service. And we are saying these are the conditions for the purpose of life-saving. Things like cardiac or pulmonary arrest, major traumas in case of an accident, someone is involved in an accident, lost conscious, you are in the state of shock, you are experiencing seizures, stroke. Then we have added anti-snake and anti-rabies venoms. Those are vaccines for the anti-snakes, venom, and anti-rabies. So this service is available within 24 hours from the time you are admitted to the hospital. It's for the purpose of resuscitating or stabilizing this patient, removing patient from danger. Then after 24 hours, maybe now you are stable, you will take, the SHIF will take care as per the SHIF benefits. Or if you are not a SHIF member, you are paying a private insurance, we'll take that or cash. But we are saying all these services will be catered within 24 hours. Then after being stabilized, now SHA will pay for that bill only. Critical illness. We have conditions which are admitted in critical centers, things like ICU, HDU, NICU, that's pediatrics ICU, neonatal intensive care unit. Initially, the time we started SHA, we used to do per level, but now we have introduced a new package. Anybody who is admitted at ICU for the first 12 days of admission, SHA will pay 28,000 per day. So that's the new rates for critical illness services. Palliative care. This is the benefit for the patients who are not really going there for the purpose of getting treated like someone is going for medical or surgical checkup. But these are patients who are facing end life. And now they should, can say they need psychosocial support for the patient and the caregiver, and to have a decent end life care. Most of those cases were just being dumped at home because insurance is not taking care of them. But we are saying, admit this patient, we will apply the rate per diem of the inpatient from level 3 up to level 6, depending where your patient is admitted. The rates I showed you at the inpatient care, they will be paid. Mainly, they are just for the purpose of maybe they have bed sores, it's just dressing the bed sores, giving them nutrition. Yeah, things like hospice. Assistive devices. These are instruments or equipment which are used for people who are enabled differently, and we want them to function properly. Now, for now, we have the hearing aid, wheelchairs, therapeutic footwears, walking frames, club foot braces, and crutches. For example, for hearing aid, we are doing 55,000, wheelchair 15. But for hearing aid, you can see there, among the access rules, hearing aid is limited to individuals aged between only below 18 years and will only be issued once per lifetime. That's a disclaimer for that one, because for the purpose to avoid abuse and fraud, that is a disclaimer on that. Although this service for now is not available, we have to get funds from the exchequer, so we are told up to 2 years. Now that's 1 year from now. Just like any other insurance, SHA has exclusions. But for this case, exclusions, I always say these are social exclusions. Things like cosmetic procedures, treatment by chiropractitioners, acupuncturists, because these people, they don't have a licensing board. So we don't know who licenses them or what they're giving to our clients. Assisted fertility treatment, that is IVF, for now is not covered. Vaccines other than those one provided by KP, the normal vaccines for the normal immunization schedule. Products outside the essential medical list, these are things like immune boosters. So many immune boosters, you have seen them in the market. These ones are not covered. And treatment related to weight management, including surgical treatment, is not covered. Medical costs related or incurred in the field of research. For example, we do research in our country, and the institution mainly is done by Cambridge. Those are trials. In case something happens, SHA is saying we will not take responsibility because that was not a medical ailment. Although you get reimbursed by this institution, you have an agreement before you do research on or trial on any clinical. Epidemics and pandemics, remember the time of COVID, government gives protocols on how to handle epidemics and pandemics. Professional fees for medical personnel over and above prescribed rates. I said, for example, CS is 30,000. If your doctor is charging more than that, we cannot adjust because your doctor is charging more than that. Expense related to diagnostic equipment, including but not limited to glucometer, BP machines. We have those patients with chronic cases, diabetes, hypertension. They need to have those devices at home, maybe to monitor the pressures, to monitor the sugar levels. So SHA is not providing those equipment to our members. Then any other intervention which is not listed among our benefit package. Just to mention this one, ARVs and malarials and TVs, these are just financed by government through their vertical program. It's just for the purpose of mentioning, but that does not mean that in case you are suffering from malaria, TB, or malaria, when admitted, SHA will not pay for you. It's just to mention. That's the end of my presentation. Thank you.
Thank you so very much for that presentation. Ladies, I'm sure you have all taken notes, and definitely this is something that could be a benefit to you and your families. For me as an example, I remember once when I had a medical issue, that would have cost me my a whole bunch of it. If it wasn't for the help that I received, I would not have been able to survive financially. Our goal as JOES is to make our members be financially secure, and having this kind of coverage will definitely put you at a place of advantage, so that when you're in a place where you find yourself in an emergency, you have the coverage required. We have been given all the information required and in ways that we can join. My one question that I kind of did not hear you address is, we do have members who also live in the diaspora. How does that work? Are we able also to, as long as if we have our KRA pins and we have our IDs, are we able to apply and join in? If you'd just like to address that for our members who are out of the country, are you able to address that, please?
Yeah, I think we can do like 5 questions, then we respond to them. If someone else has a question, we can pick like the first 5.
Ladies, you're able to unmute, just unmute and then ask your question.
I have a quick question.
Yes, just go ahead with your question, please.
Yeah, among the beneficiaries, I was wondering about somebody who has elderly parents. Can those be beneficiaries or they are registered independently?
Sure. Next.
I also have a question, though I've written it on the wall, but I started registration. And before I could go to the questions, the amount of money that I was supposed to pay popped up, and I'm supposed to pay 36,000 per year. So I was wondering, how was that calculated? I'm not on any payroll.
Okay. Any other?
Yes, I do have a question. How does the assistance with rehabs work? Yeah,
Okay.
that's it. How can I, like, if I have a person who is in SHA who needs rehab, how do it work for them?
Sure.
I have a question too.
Yeah, go ahead, Jean, and then I see a Ching. I see your hand up also, so go ahead after her.
The question that I have is so much related to what the person just asked about rehab. So I don't know if we can combine them. I was wondering if SHA pays money for specific rehabs, because we have also got different categories of rehabs in Kenya.
Okay. Next, we can do those 5, then we pick the next 5.
Can I ask mine, because it's related to one that has been asked on the diaspora? What would be the rate that you would be charging the people in the diaspora?
Okay. Thank you. Deka, you online?
Yes, I'm here, Mike.
Yeah, you can do
you want me to take which question on the diaspora and the means testing?
Diaspora means exactly.
Okay. For the diaspora, I just want to understand, because SHA is within Kenya. So even if you register and pay, the services you'll be getting is within Kenya. So I don't know if you're thinking of accessing abroad or something, but what I know is SHA is within Kenya. So you can still pay within, you can register, so long as you have an ID, you can register and pay. But the services is only like limited to the Kenya and maybe abroad in terms of overseas treatment. So let's say even in America, we don't have any contract. For currently, I think we have only in India, and I think Turkey. Those are the ones we are currently doing. So with time, they'll be on board, but currently, that is the only agreement we have with those 2 countries, some hospitals in those 2 countries. So I don't know if I've answered your question on that, but you can register and pay. And you can also register for your parents or your sisters and pay, and then they enjoy the services for SHA. So I don't know if I've answered you that question.
Yeah, partly, but you haven't given us the rate. And then just to clarify, I think
the rate, I'm coming to that.
Okay.
The rate, you see, for the people who are employed, it's very clear. It is through their payroll, 2.75 of their gross salary. And the people who are not, like, I will not call them unemployed as such. I think the act says the minimum is 300, yeah? This one was meant for the mamambogas and the people who are in formal employment. Informal employment, the Juakali sector and all that. But there's a category who we all call them self-employed, because you can be self-employed and you're running your company and all that. We still call you self-employed, but you want to come through the informal sector. That is when the proxy means testing comes in. So there's someone who has logged in, registered, and got 37, I think 36 or 37. What the proxy means testing does is, you know, your details are with KRA, yes? You have the PIN. It is tied to your PIN, what you own and everything. So we've gotten to a point where we had means testing and people were answering questions, and everyone was lying that, oh, I live in a mud house, a grass thatched house. I take my water from an unprotected stream. So most people are lying about it. Yeah. So the proxy means testing was introduced, I think, a month ago, whereby anything you own in Kenya, because of the PIN, it calculates based on that. But I think there's a lot of complaints and there's a lot of outcry from the Kenyans, the public. So there's something that is being done. Maybe in the next 2 weeks, there's something that is being done. And then if you look at the difference between SHA and the defunct NHIF, and I think my colleague covered this, George covered this very well. There's no waiting period. With NHIF, there was a waiting period. As much as we were paying the 500, there was a waiting period of 2 months or 3 months, yeah? But with SHA, once you pay maybe your 20,000, and even if you come here and say, I'm going abroad, so long as you are a paid up member, you'll get that 500. I think even locally, Mwanzia will correct me, we have the open heart surgery. It is going to, I think, 1.2, 1.3. So imagine you've paid only 30,000 and we are paying 1.5, 1.3 to that amount. So as much as the means testing is not 100% perfect, it is being done. So you'll just bear with us, but the means testing will still be there for the people who are self-employed. So I hope I've answered that question.
Yes. I think the next question was
have
about...
I clarified something? I know it's not perfect, but there's something being done about it. And it's not only you, it's not only this group, but it's everyone, the member of public. And the payments are being done annually. Because we realize when once we get services, we paid, let's say, someone 500, a procedure for 500. After that, the person disappears. So, and this is a social scheme, ni kama chama. So if some people, members who are just paying to benefit, at the end of the day, we will not have SHA. Yeah. So I hope I've answered your question.
Okay, we can move to the next question.
Mine has not been answered because you talked about these proxy questions or something like that. When nobody asks you those questions and they determine what you are supposed to pay, how is it determined? You are not working, you are not on any payroll, but nobody asks those questions.
If I may, when SHA started and they came up with the proxy means testing, you had to go through all a member had to go through all the questions, and then you are given premiums supposed to pay. But as Beck is trying to explain, even at that point, there was a lot of complaints because you could find two people who are in the same social setup. Say, for example, Kibra, they live in the same social setup and they're doing registration at the same time. When I mean social setup, it means the questions that were there, you'll find that there are questions like what amenities like toilet, water, where do you get your toilet, water, the kind of toilet you use, the kind of house. And you'd realize these people in such a setup, the housing would probably be the same, the water, the toilet facilities would be the same. But upon finishing submission, they were getting different premiums. And that is where the complaints started coming from. Now, down the line, a couple of months down the line, we came to realize that, like in your case where you just registered them you had an auto, like an auto pop-up of premium. That came up, and that even raised more complaints because people are saying, I've not answered any question. Why are you giving me this? And that's why actually MOH is back again on the drawing board to try and see the best way to handle this thing. It is true that the complaints are there. The offices are full. Phone calls are there. We are being called from left, right, and center. Even our relatives. Even me, I've tried registering a relative of mine who I used to pay for NHIF, and premiums popped up, which to me also were high. So we keep forwarding these complaints, and we are hoping that they do something about it, so that members can be given a chance maybe to review or redo the means testing proxy questions, and come up and get better or premiums that really reflect their socioeconomic status. But it's something we are waiting for, and we hope to come up. They'll resolve it soon.
But if I understood you correctly, you have also said that they're not only using those questions, they're also using anything that shows up on our pins. So if you've paid taxes of a certain amount, it's actually putting you on a certain income tax bracket. So they're deducing from that is what you're due, or that is how they're calculating that percentage that they need. Am I correct to think like that?
And yes, because at the end of the day, because even the questions for means testing was asking, do you own a land? So when you say that was before the proxy means testing was introduced, because when you say when they ask you on the question, do you own a land? Most Kenyans will say no, but already if you own a land, it will pick from your PIN. It will pick for your car, your logbook and all that. So that is why it's called a proxy means testing that was introduced. So long as you have a PIN and there's an income coming in, yeah, that is where it's coming from. That's why we're calling it a proxy means testing. And I keep on saying it is not 100% correct. That is why they're also introducing a mechanism of appeals, which is not there currently. But as you know that as SHA we listen. So that is why we went back to the drawing board. The Ministry of Health, as my colleague said, is currently working on something.
If the moment you have a PIN and it will show that you're a directing company XYZ, you own land or buildings XYZ, as in the PIN reflects almost everything, and maybe your social status, socioeconomic status. And I think they're pegging or they're tying some of the means testing to it to determine the 2.75%. Let me use that lightly, because as I was presenting earlier on, I said even those who are not in formal employment, they're trying to look at that household, whatever is deemed to be income to that household, that want to peg 2.75% of it. So yes, just to answer, your PIN is coming very key to determine what you own. Because I could say I don't own anything. Like one of the questions, do you own land? What size? But I said I don't own, but my PIN shows I own parcels of land all over town. So that could determine or could make them give me a different premium as to what I would, as an individual, would have wanted to pay, or to be the premiums to pay. But as we know it's being worked on. We know the complaints are there, and even through this presentation, there's some of the things you're going to raise. We keep sending, anytime we have an issue like this, we send them to our superiors, who escalate them to MOH for them to relook and find a better way of members getting premiums that are reasonable, but again, premiums that can also make SHIF be sustainable to take care of the public. Thank you.
Thank you. The next question was about rehab process of how someone can get an admission at rehab, and on the same, do we have specific rehabs with specific cases? Allow me to say this. As long as a rehab is licensed to operate in Kenya, whereby they are supposed to get two types of license. The first license is from Kenya Medical Practitioners and Dentist Board Council for the purpose of licensing as an health institution. Then the other license is NACADA, to be approved by NACADA to offer such services. That institution is free to get contract from SHA. If you go to an institution and they tell you they are not offering SHA services, that means they don't have contract with SHA. But SHA contract is open, free, as long as you meet minimum requirements as per the guideline from the MOH, you get your contract. And the process, let the patient identify the institution where he or she wants to be admitted, visit the institution, provide your ID for the purpose of SHA at the point of admission. SHA will do an approval, we call it pre-authorization, at the time of admission of 67,200 as a package. So the total bill will be less that amount paid by SHA. That's how to access a rehab services and where. Unless it was not clear.
Okay. Okay. So further to my question, does that mean that this person should show up at the rehab and then ask for the, or by the time they leave, it will have been sorted out?
The moment you show up at the rehab for the services of rehabilitation, that's the time you produce your ID and you tell them, I'll use my SHA, not at the time of discharge. You notify the hospital at the time of admission, because even as a SHA, we want to confirm for sure during these 3 months, 2 months, is our client there? Most probably our person may come for surveillance to confirm. We have a medical team will go around and confirm and see the nature of treatment. So it's at the time of admission, not the time of discharge.
I still have a question on that too.
Sure.
Did you say that SHA will pay something between 67 to 200,000?
No, I've said we pay a package of 67,200 shillings for the entire admission.
67,200 shillings.
Shillings for the entire period of admission.
All right, thank you.
You're welcome. We can do the next round of questions.
Monze, before I hope that we've covered all. We've not left anyone out. The 5 questions. Yeah. I hope we've covered all of them. Okay.
As per my list is okay.
One more question, please, on the same.
Yep.
Are there a number of times somebody is allowed to go to the rehab? Because we have got some people who relapse.
That benefit package
yes,
is per annum.
All right.
Per annum, per household. So in case you have 2, it's only one will benefit with that 1 year.
All right. Thank you.
Yeah.
Michael, I lost net a little bit. And did we answer the question on the elderly parents?
I think
that has not been answered.
Yeah, George, you can go ahead or answer it.
On the elderly parents, that they are treated as a household. So that is to mean I cannot declare my parents to be beneficiaries under my card. The card is for a nuclear family. So our parents, we will have to register them as a household, do for them the means testing, and then pay for them. Just the same way under the defunct NHIF, we paid for our parents as a separate household. So yes, to answer your question, you cannot declare them as your beneficiary, but you can register them as a household and pay for them the premiums. Thank you.
Thank you, George. We can do the next round of questions, if any. I've seen several hands up.
Damaris, and I see your hand up. You can go ahead and ask a question. Acheng, I also see your hand up. Also, you can go ahead after Damaris. Go ahead, ladies.
Yeah. So if somebody's status changes, meaning they were employed and then either they retire or they maybe lose their job, because employment will be paying automatically. When that ceases, is it easy for them to go to their website and change their status and get a new rate, or do they have to go physically to an office to change their status? And vice versa. Sometimes they were doing the other way. Thank you.
Sure. Acheng.
Thank you for the information. So my question is, I have siblings. One of my siblings, both of them unemployed, one of them got SHA for 500 shillings. And so this month when we were trying to register the other sibling for SHA, we were told that they will now have to pay like 5,000 shillings and some hundreds there. So I just wanted to know what changed. Did something change that made the price go up from 500 shillings to 5,000?
Were you paying for the same person?
Not the same person, a different sibling.
The other one. Okay.
So one sibling already has one. And by the time we were inquiring, it was still 500. So we delayed a bit. And then when they went to try and pay this month, June, they said, oh, now it's like 5,000. So my sibling had to struggle now to try and get that 5,000 shillings because they knew that it was 500. So what changed? Thank you.
What, just to clarify, was this 5,000 per month or annual?
It's annum, per annum.
I don't know. I
In
just
fact,
know
George,
that initially
George,
it was 500
Yeah.
and it's changed to 5,000.
Well, this one was not paid. So the moment they are trying to pay, for now you cannot pay monthly. You are paying per annum. That's what changed. So I think to clarify your case,
Yes.
Initially, sure, you are able to pay 500 on monthly basis, but now, as per the Act, premiums for informal sector, you are supposed to pay per annum. That's why that amount was calculated for the next 12 months.
Okay, let me ask to make sure that the first one was monthly. Also, do you mind sharing the Act, the link to the Act, the SHA Act, so that we can review it? Thank you.
Can I clarify something? All the documents that we are sharing today they're all available under www.sha.go.ke under resources. The Act is there, the regulation is there, the benefit package as gazetted is there. What we were giving you today was just a summary of the highlights. But please, I'd advise you everyone to go back, read. Information is power. So read. You'll get everything there. You can test, you're all online. You can just log into this. You can just check on our website on the resources.
I've gone to your website and I can't see the Act. I may have missed it, but it's not there.
And then I'd also just like to also tag on a question to the one that has just been answered. Because the premiums are paid per annum ahead for the year ahead of time, if your status changes from you being somebody who's employed to somebody who's not in the non-formal sector anymore, do you get a refund? Does it just continue with that same rate? Do you just finish off what you've already paid and then in the new year start over again, or how does that work? And then after Ching, Damaris was there, and then I see Susan also's hand is also up in that order.
I already asked my question. It's the one on status changing. I don't think it's been answered though, unless they're still picking questions.
Okay, George, you can respond to the case of Damaris whereby someone changed from employed to self-employed and the vice versa.
Thank you, Mike. As I mentioned earlier when I was presenting, SHA has been done in a way that you are in full control of your account. So if your status changes from employed to self-employed, just log into your account, go under profile, update to self-employed. Now, once you do that, then now you will do the means testing that you've been talking about for the self-employed. Then once you complete the means testing, you'll know the premiums you're supposed to pay, and you do the payment. So it's that easy. You are in control of it. You don't have to visit any of our network branch networks or Huduma Center. You do it from the comfort of your home or office. Thank you.
George, still on the same. I think there was a question raised from there for self-employed person who are paid for upfront 1 year, then employed in between. What happens to the funds?
This is a question that I think that I'm getting it from the fourth, if not fifth person asking me this, where a member is, for example, the lady was told to pay 30-something thousand. And let's say in a scenario where she paid the 30,000, and then 2 months down the line, she's lucky to get employed. What next? It is something that we actually even discussed with Madam Decker, and we are escalating it so that they can give us feedback. So I don't want to say that we have the answer now, but we forwarded it because we had like 3 or 4 cases. This is now the 5th I'm getting. And I think it's a scenario that maybe had not been taken into account. So as we forward them, we hope they'll give us a response on how to handle such cases where a member paid 1 year in advance and down the line get into formal employment. So to the lady who asked this, kindly allow us to wait for feedback. We had already escalated. Once we get it, we'll communicate. I think we are all in contact with Cynthia and Jackie. We don't have a definite answer to this question, but we'll communicate once we have it.
Thank you. We can move to the next round of questions.
Manzia, let me just clarify something. I've gone to the website. Sorry, I need to apologize. I'll share with the team leader. We'll share the SHA Act, but I believe they should be under any gazetted, under the Gazette notice on the legal website, yeah? But I'll share, but the benefit package is there. And the benefit package has a lot of information on what is covered and what is not covered. The tariffs, they're covered. Sorry for that. We'll share with the team leaders in this forum.
I had a question, may I?
I also have a question after you. Thank you.
Okay. I think this has been partly answered. I just need to be very clear on it. I'm self-employed, as you called them, self-employed. And up to last month, I was able to pay my premiums monthly. But when I tried to do that this month, I was not able to. Did you say that it's a law that self-employed people now must pay their premiums for 1 year in advance? 1, 2, don't you think that you'll be locking people out? Because if I cannot even, it's a struggle to pay for 1 month. Now you want me to pay 12 months in advance. Won't you be locking us out of this? Thank you.
Gladys?
Okay, I'll go ahead. My question is, if I pay the premium for the whole year and I happen to pass away, I don't have any beneficiary, that would be using that SHA, are you people able to refund me the money that I had not used during that year?
You're dead.
Or to refund my beneficiary?
Okay, any other question? So I believe we've answered the two, then we call it, is it a day or night? George, still the case of someone who is unable to pay 1 year. Are we locking them out? Kuna lipa pole pole. Can you elaborate for us about that one?
Thank you, Mike. Now the question was, she was trying to find out, is it a law that self-employed premium must be paid annually, given that she was able to pay installments at the start? Yes, if you look at the SHA Act, which will be shared, the premiums, it's a law. It's in the act that the self-employed or the voluntary contributors make premiums upfront of 1 year. Now, during the introduction of SHA, people were allowed to do the monthly installments. People are allowed to do the monthly installment, but up to some point, as I explained, SHA is that the moment you register, you pay. The moment you pay, you instantly qualify to benefit. Now there was adverse selection where the public learned of this, and so as you're aware, we are very tech, and we consume information very fast as a public. So the public learned of this, and so everybody stopped making premiums like they used to do for NHIF, the monthly, and people were waiting for the need to arise. So I would see it. I would say I was one of them who told my parents, don't register first. So people are waiting for the need for service to arise. Then I would register and pay a premium of, say, 2-3 months. And as Mike said, and then a member goes and is given surgery for hundreds of thousands of shillings. Now, it was realized that, number one, that is not sustainable. And so because of the adverse selection. So now they reverted to what the law said. The law says that self-employed premiums are to be paid upfront 1 year. So for those who had started paying maybe 1 or 2 months, like the case of the 5,000, and initially it was 500. So I'm trying to assume that she had paid 2 months. That is 500. And then now when she wanted to pay for the 3rd month, she was told, no, now you have to pay the entire premium, the balance of 5,000. So they locked the system now that you have to, once you register now, for you to benefit, or if you already registered and you have done some premiums, you have to clear the top up the balance for the one year premium. I hope I've explained that a bit clearly so that.
Can I ask a question based on that again?
Let's go ahead, please.
Yeah. What is self-employed is when you are a pensioner. Are you self-employed?
Self-employed. The
reason why I'm asking that, the reason why I'm asking that, I'm the one who asked about the 36,000 that just popped up, and
yes.
I'm a pensioner, so I was just wondering, how do am I now self-employed? Am I considered as self-employed, or am I I don't know. It is just mind-boggling.
And let me add on what Georgia said. A self-employed, there are 2 categories of self-employed. And we call self-employed or the ones who are, it's not a must for you to contribute. These are voluntary contributors. So two categories of self-employed. I can be having a business, yeah, my own business. You're still a self-employed, yeah? And your case for retired is a voluntary payment, yeah? In cases where we have, I don't know if you have a pension scheme, because there is a body like the Central Bank of Kenya, they have a pension scheme, yeah? So what they do is before they pay their retirees a certain their pension, yeah, they deduct them the 2.75. So for the retirees, we encourage them to come through their pension. And there are so many of them who are already doing that. I know the KCB, the Posta, the ones for Kenya, KCB, there are many of them. So they're not coming under self-employed. They're coming under a formal sector setting, whereby before they're getting the pension, even if it's 10,000, we're getting 2.75. And actually, most of them are contributing between 500 and 300. So I think for you, you have a special, it's a special case. If you can talk to your pensioner, if they can come up with something. So many of them have done through SHA. For the retirees, they've come through that body, and they're even paying less.
Thank you so very much today.
So I don't know if that is okay with you.
Yeah, I just want to say thank you, and I want to also respect our visitors' time and also respect our members' time. We've kind of gone over time. Normally we stay kind of an hour and a half. We are almost at the 2-hour mark. I really would like to give our guests opportunity to to respect their time really, and just say thank you for being here and thank you for having such a robust discussion and being able to answer all our questions. We have a lot of questions. Ladies, take time, as Decca already told us, Miss Decca already told us, information is power. We have the website now. We can go to the website, make sure we register. Let's register our relatives. Let's put ourselves in an advantage financially, also being able to get medical attention when needed and not be in a rush and have to do GoFundMe's and all those things. But let's stay ahead of our game. With that being said, if you have any additional questions, maybe let's go to the website, or we can reach out, or put your questions down on the chat. I want to give our visitors also an opportunity to either, if you have a last word that you want to say, or if it's also time to leave, I want to also respect that. Ladies, as usual, we can always stay behind and chit chat if we want to. That's always an open floor for that. But I just want to thank everybody again, and thank you so much for this information, because it is needed, and it has clarified, I think, a lot of things for all of us, because we've really been confused about this SHA, SHRU. Half the time we didn't even know what it was, but this was very educational and it clarified a lot of things, at least for me. With that being said, is there anybody who's willing to pray us out and just say, thank God for this opportunity? Do I have any takers on that?
I'll pray you out.
Okay, thank you. Go ahead.
Almighty Father,
and before you pray, can I say something?
Sure, go ahead. Sorry. Sorry, I had said if you have a word to say, yeah, after your word, then we can go ahead and definitely pray. Go ahead,
Okay, I was
Becca.
just saying, and I know this information is too much, and as you digest and if you have any questions, I think Cynthia, the team has our numbers, and you can be served in any Huduma Center or any branch of SHA anywhere in the country. So don't limit to this place. I'll share also my contacts. You have my contacts and the team's contacts. So if something comes up, don't hesitate to call us and confirm. We are here to serve you. We are here to serve Kenyans. Thank you.
Okay, can I go ahead and pray now?
Yes, thank you so much, Ms. Decker and your team. Thank you.
Jackie?
Yes, go ahead.
I've received the SHA Act. I'll be sharing on our WhatsApp group.
Okay, thank you very much. Ladies, you hear that Cynthia will be sharing that with us on our chat groups. Okay, you can go ahead and pray for us out.
Okay. Almighty Father, in the name of Jesus, we want to thank you for this special day that you've given unto us. We want to thank you for our visitors, and we want to thank you even for the service they're rendering to the Kenyans. We want to thank you for all the JOS members, those who are able to be in attendance today, and even those who are not able to be in attendance today. We want to thank you for everything that we've been given to consume today. May you give us the wisdom to make the right decision every time, even when it comes to things concerning our health. Father, we want to thank you for those who are going to bed tonight, and even those who are traveling. We commit them unto your hand, that you will give them journey mercies. Those who are still having their day, we commit them unto your hand, that you will bless them. Thank you for everything. For those that I have not mentioned, may you continue guiding us. I've asked all this trusting and believing in Jesus' name. Amen.
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 Thank you. That was great.
Yeah, thank you so much. Now we have gotten to the informal part of our meeting. Our official meeting is over. Cynthia, whoever has the recording, you can stop the recording now. That will allow us to give our members the recording. For those who are not able to be here today, you can stop the recording, and then we can definitely, those who are available to just stay and chit chat, you're welcome to do that. If you want to get off become, if you want to put your face, put your cameras on, you're welcome to do that. But I really definitely enjoyed the session, and thank you, ladies, for being here. It's been an amazing afternoon, and thank you again. Karibuni.
Thank you and good night.
Hello, ladies.